and policy supports, but it is critically important that we have legal more than happy to
come for assistance, provide invaluable services.
That's okay. Thank you.
I think Bugger I, the third topical is in the name of Deputy Holly Cairns to discuss funding for family resource centres.
Thank you, Laskin Corla. Family resource centres provide invaluable services in communities across the country. They're a place that people can come for assistance, support and for information on everything from state services and training opportunities to counselling. They're a one-stop shop for many vulnerable individuals and groups, including lone parent families, older people, people experiencing poverty, addiction and many others. Given that we know one of the primary indicators of poverty in Ireland is lone parent families, the types of practical support and intervention these centres offer makes an enormous difference to so many families. All of these people can be guaranteed to be treated with respect and dignity. Each centre is staffed by professional social and support workers and led by local volunteers who devote considerable time to improving and ensuring their success. They are also interconnected with other services and groups, helping link different people. For example, in Dunmanway, Meals on Wheels and the Community Garden are based in the centre. In Cork South-West, we're lucky to be served by a family resource centre in Castletownbere, Adrigole, Dunmanway, Skibbereen and Bandon, and they're an essential support facility embedded into those communities. However, a major issue they face is security of funding. They receive funding from TUSLA, the HSE and other state bodies. However, it's often insufficient, disparate, it isn't multi-annual, none of which allows them to work to their full potential. Minister, I've been working with a few different centres to try and help them to navigate the process, but it's Byzantine. These issues are particularly affecting the centres in Skibbereen and Bandon, who are in search of permanent locations for the Family Resource Centre. The Skibbereen Centre has had to move several times, so many times in the space of a year, from rented space to rented space, which is highly disruptive to the service, confusing for people using their services. And in addition, they're now operating on a year-to-year lease, adding even more uncertainty. And they're saying very clearly that the next time they move needs to be the last time that they move. They desperately need a permanent location to operate out of. This would enable them to solidify their position, develop their services, and would free up time currently spent worrying about and seeking space. The Bandon Family Resource Centre is similarly in need of a new location. The nature of their work demands that the building has spaces for confidential meetings and can allow easy access. I've been working with them on the possibility of finding either a HSE or council-owned building to use. But these cases require proper capital funding to assist them. It shouldn't be up to local volunteers to find spaces or even for local TDs to act as some kind of intermediary with state bodies. These centres, like all others, provide absolutely essential services and they need to be recognised. Like many of these organisations, they actually end up saving the state money through early interventions and on-the-ground supports. These vital links that prevent issues escalating. They need to be recognised in funding terms. Firstly, this means funding levels that reflect their work and allows them to operate to their full capacity. And Minister, the Department and TUSLA need to work together with the Minister probably for Health and HSE to establish a system of funding that will give each centre greater assurance and confidence. Every euro invested in them will pay back manifold, as well as the invaluable service they'll provide in these areas. Secondly, and urgently, the Bandon and Skibbereen centres need capital funding for permanent locations. It's currently unclear how they'll operate in the long term. There's no natural funding streams for them to go to apply for. Some resource centres are HSE buildings, others are not. How does a centre go about securing permanent accommodation? There's no clear process to follow about this. Can you please give us some guidance to help address the issue? Thank you.
Again, Gormagat Chocta, and again, thank you for raising this issue. I would have worked with FRCs and both in a voluntary capacity down the years, and I agree with you wholeheartedly. The invaluable services they provide for families, family support for children. Many of them have community childcare centres attached to them, and as we previously speaking about addiction services and recovery services, they really are the backbone of many rural and urban communities. And the Government greatly appreciates the valuable work of our FRCs and the work of the community and voluntary bodies funded by TUSLA Child and Family Agency. Minister O'Gorman has personally met with a number of family resource centres over recent months to discuss their concerns, and this area of work is a significant priority for him and for Government. Over a period of 2 years, 2018 and 2019, the Department of Children provided TUSLA with additional €4.5 million to invest in FRC Centre programme. This funding facilitated the expansion of the programme to 121 family resource centres and provided additional supports in core funding for existing family resource centres. In 2020 and 2021, TUSLA provided additional supports as needed to family resource centres and other funded community and voluntary partners to assist with pressures arising from the COVID-19 pandemic. In 2021, TUSLA had a core budget of €18 million for the Family Resource Centre programme, and this is a portion of over €130 million in TUSLA funding to community and voluntary bodies associated with the statutory remit for family support. In Budget 2022, additional funding of €6 million is allocated to enable TUSLA increase supports for the wider community and voluntary sector and increase supports for family resource centres. An additional €650,000 was allocated to family resource centres in 2021 from the Dormant Accounts programme. A further €1 million in Dormant Accounts funding is being provided to FRCs during 2022. Minister O'Gorman is aware that the family resource centres are providing significant levels of assistance on the ground to communities who are welcoming Ukrainian people, and he has asked TUSLA to continue to support FRCs in those efforts. Minister O'Gorman will be seeking funding for family resource centres for this purpose specifically during discussions with the Minister for Public Expenditure. While TUSLA is a significant funder for FRCs, other government bodies also provide substantial funding to FRCs to deliver services on their behalf. A short study of Family Resource Centre funding in 2020 highlighted overall more than half of their funding came from non-TUSLA sources, such as local authorities, ETBs, HSE, PUBL and the Department of Social Protection. As you may be aware, TUSLA provides a range of family support services, both directly and through its commissioned partners, which include FRCs. TUSLA family support services are delivered on the basis of low, medium, high prevention. TUSLA is working to embed and develop a consistent national approach to practice all its response pathways, and this aim is to ensure families receive consistent service levels across all TUSLA areas and all levels of need. I'll come back in on the supplementary, but specifically in relation to Bandon and Skibbereen, it is incredibly tricky to find premises for starters that are suitable. I mean, there's probably no shortage of vacated or empty buildings, bank buildings, etc. But they have to be fitted out, and capital monies are, I mean, either through the LEADER programme or through SICAP, perhaps could be some mechanism of supporting them to find a permanent home, and absolutely sympathise with both FRCs in trying to secure that, and securing long-term leases on a premises is incredibly tricky, and making them fit for purpose for the specific needs of families, I think, is the huge challenge. But I'll come back in just on the supplementary in response. Okay.
Thank you, Minister, for your response and commitment to family resource centres. Their essential public support service, the Centre in Cork South-West, represents the incredible success they can be in helping groups and individuals. However, those same centres also illustrate the weakness in the model, with insufficient funding and reliance on local goodwill and circumstances rather than systematic supports. So those funding allocations that you mentioned are so welcome and they're great, but they don't address those issues in Skibbereen and Bandon, the centres who need capital funding more immediately. So I think there has to be a way where your department can work with the Department of Health in working with them to acquire a building or appropriate facilities to ensure the future of the services, because to be honest, when we're going about this and we meet, we don't even really know, should we be looking for a greenfield site? Should we be looking at HSE-owned buildings? We don't know how to go about it. What should we do? I know you're familiar with the type of work they do and the importance of them, and you said you sympathise with them, but I suppose what I'm asking you to do is to work with them as well as sympathise with them. The Family Resource Centre model, like so much of our social and healthcare infrastructure, sees the provision of services through bodies separate from the state. While this offers increased local independence and capacity to respond to issues, it also places undue responsibility on volunteers. The boards of management for both centres do tireless work, not only keeping them operating, but also in trying to guarantee their future. And Minister, they need you to support them in supporting their communities. I'd suggest that if you can, I'd love for you to come and visit the centres and to meet with the locals and the staff and the volunteers there to see what difference they can make and how much this support is needed. Thank you.
Again, just in the response I have here, I mean, I think they talk about the different sources of funding, and in many ways, FRCs are left chasing funding programmes and designing projects around specific funding programmes, which can be a huge task in itself. I know Minister O'Brien, through his work, has also rolled out an additional 7 pilot CDPs, community development projects, which is most welcome because a lot of those CDPs went the road under a 2009 cohesion programme. And I do think that we do want to specifically focus and support those community development principles that FRCs do so well. I will pass on the request to Minister O'Gorman specifically about visiting both Bandon and Skibbereen if he's on a scheduled visit to the area. And again, you know, that point around the capital funding securing a premises, be it greenfield site, it's hugely challenging, and hugely challenging for a voluntary board to try and embark on a process like that. I've been on voluntary boards of FRCs and I know exactly what it's like. So again, I'll take back the request that you've put to us here this evening, but you know, and I think it would be important to try and support them, support the work they're doing, support the voluntary board in trying to achieve its objectives and find permanent homes specifically, because these families need all the help that they can get in the community, and they need that certainty of a permanent home as well. But you know, the funding issue, I think multi-annual funding is a tricky one. As I said, there's quite a number of sources of funding, not just TUSLA, that FRCs can draw down. But they need to be in a strong position, and they need to have a strong voluntary board to be able to support managers and staff to be able to pursue those streams of funding. So I'm sorry for the roundabout answer, but I will take back the specific request to the Minister for you.
Okay. Now